You've been told your whole life to go to the doctor. Get your checkups. Stay on top of things. And for most of your life, that advice kept you safe. But here's what nobody tells you when you cross 65. Some of those routine appointments, the ones you've been scheduling faithfully for decades, can actually start working against you. Not because medicine is broken. Not because your doctor doesn't care. But because the human body after 65 responds differently. Screening tools designed for a 40-year-old body can trigger a chain of events in an older body that causes more harm than the condition it was meant to catch. I know that's uncomfortable to hear. It was uncomfortable for many physicians to say out loud, too. But the research is there. And you deserve to know it. Number 1, routine annual EKGs for low-risk patients. If you have no history of heart disease, no symptoms, no risk factors, and your doctor is ordering an electrocardiogram every single year simply as part of a standard package, the evidence says that test is not helping you. The U.S. Preventive Services Task Force concluded that routine EKG screening in asymptomatic, low-risk adults does not reduce death or cardiovascular events. What it does do is create false positives. Irregular readings that look alarming on paper but mean nothing clinically. And those readings lead to more tests. More stress. Sometimes invasive procedures. All for a heart that was fine to begin with. Pause here for a moment. Think about how many times a test result has sent you spiraling, waiting days for a callback, imagining worst-case scenarios, only to be told it was nothing. That anxiety has a physiological cost. Especially after 65. Cortisol spikes. Blood pressure climbs. Sleep fractures. A test that triggers that cascade, for no clinical benefit, is not a gift. It's a burden. Number 2, PSA screening for older men without symptoms. This one stirs controversy. And it should. Because prostate cancer is real, and the fear around it is completely valid. But here's the honest truth that urologists will tell you quietly, even if they don't always say it loud enough in the exam room. Many prostate cancers found in men over 70 are what doctors call indolent. Slow-moving. So slow that statistically, most men will die with that cancer, not from it. And yet, once a PSA result comes back elevated, even slightly, the machinery of modern medicine kicks in. Biopsies. Anxiety. Possible treatment. And prostate cancer treatment in older men carry significant risks: incontinence, erectile dysfunction, fatigue, sometimes cardiovascular strain from hormone therapy. The American Cancer Society itself now recommends that men over 70 with a life expectancy of less than 10 years should not be screened routinely. Not because their lives don't matter, but because the treatment they'd receive after a positive result could damage their quality of life more than the cancer ever would have. That is a hard sentence to sit with. But it's an honest one. Number 3, routine colonoscopies after 75. Colonoscopies save lives. For adults in their 50s and 60s, they are genuinely powerful tools. But after 75, the calculus changes, and dramatically so. The procedure itself carries higher complication risks in older adults. Perforation. Bleeding. Adverse reactions to sedation. And for people with multiple health conditions or on blood thinners, those risks can be serious. Major medical bodies, including the American Gastroenterological Association, now advise that adults over 75 should have individualized conversations about whether to continue screening. If you've had multiple clean colonoscopies, the benefit of continuing decreases significantly. The colon doesn't suddenly start misbehaving after a lifetime of clean results just because another year has passed. But so many people at 78, at 81, are still showing up for these procedures out of habit. Out of obligation. Out of fear of being seen as someone who gave up on their health. You haven't given up. You've gotten smarter. Number 4, routine bone density scans more frequently than guidelines recommend. DEXA scans, the imaging test used to measure bone loss, are genuinely important. But they're recommended on a specific schedule for a reason. For women at average risk, guidelines suggest screening at 65 and then repeating only based on results and risk level, typically every 1 to 2 years if treatment has begun. What happens in practice? Many older adults are getting these scans every single year, sometimes at the request of multiple specialists who aren't communicating with each other. Here's the problem. Repeated scans don't change bone density, they just measure it. And if you're already on treatment and your levels are stable, another scan isn't giving your doctor new information. It's giving you another copay, another trip to a radiology center, another number to worry about. It's also worth knowing that bone density scores, T-scores, can fluctuate slightly between machines, between technicians, even between mornings and afternoons. 2 consecutive scans showing a small difference might look like bone loss when it's actually just measurement variation. And that variation can push a physician toward adjusting medication unnecessarily. More treatment isn't always more protection. Sometimes it's just more noise. Number 5, annual full-body skin checks when you have no history of melanoma and no changing lesions. Dermatologist visits have become almost fashionable as we age, and there's genuine logic to that. Skin changes with time, and vigilance has real value. But the U.S. Preventive Services Task Force found insufficient evidence that routine whole-body skin exams in average-risk adults actually reduce melanoma mortality. What these exams frequently do instead is identify benign lesions, seborrheic keratoses, age spots, harmless cysts, that then get biopsied. Biopsies that come back benign. Biopsies that cost money, leave small scars, and cause days, sometimes weeks, of quiet, grinding worry. And worry, at 65, at 70, at 75, it has weight. It sits in your chest differently than it did at 40. It interrupts sleep. It changes how you eat. It pulls you out of ordinary moments that deserve to be enjoyed fully. If you have a lesion that is changing, bleeding, growing, or genuinely concerning you, go immediately. No hesitation. That is exactly the right call, and that is precisely what dermatologists are trained for. But a standing annual appointment where every freckle gets photographed as a baseline exercise, for someone with no risk history, no family history of melanoma, no suspicious lesions, the science simply does not strongly support that practice for older adults at average risk. Now, here is what everything you just heard is not saying. It is not saying stop seeing your doctor. It is not saying medicine has failed you. It is not saying your health stops deserving attention after a certain birthday. It is saying something far more specific, and far more important than that. After 65, the most powerful sentence you can bring into any exam room is this one. Given my age, my actual history, and my real risk level, is this test likely to help me, or could it start a chain of events I don't need? That question isn't combative. It isn't ungrateful. It is, genuinely, the most medically informed thing you can say out loud. Because the goal was never more appointments. The goal was never more paperwork, more waiting rooms, more anxiety spiraling in the car on the way home. The goal was always, only ever, more life. More mornings. More meals. More presents. If this shifted something in how you think about your health after 65, please share this with someone you love, because the person who needs to hear this might not find it on their own. And drop a comment below telling us, has a doctor ever actually said any of this to you? Those conversations deserve to be heard. Those physicians deserve to be celebrated.